larynx, right, off very brutally. Hyoid bone, what looks like bone. Thyroid cartilage, can't miss it in blue. Cricoid cartilage, just inferior to that. Epiglottis and arytenoid cartilage, it says not there. Number 4 is not there, sorry.
Yeah,
So this would be your epiglottis, right, and your cricoid cartilage on the back side. Those are tough labels. Right? Cartilage is usually in blue, right? So I wouldn't worry about these ones too much. Right? We got those bigger models to label those, arytenoid and epiglottis. So we're just going to keep going. Trachea, right, is the windpipe. Right? So that would be this big trunk of a tube, which kind of disappears right, deep to those large arteries and veins. Right main bronchus, or you can say right primary bronchus. Right, so we took the heart out, and you can see the bronchus going to the right lung, which of course you show us another left lung, right? And that's before the split. Right, so you got the right main bronchus and the left main bronchus, or primary bronchus. Next one is pulmonary artery, left or right. You can see the arteries. Remember, in pulmonary circulation, the arteries are low oxygen, right? So that's an easy one to mix up if you're rushing. But it's labeled number 8, if you can see that. Right, that's the left pulmonary artery. There's the one on the right. Right there. Next label are the pulmonary veins, which will be in red, right? So you're going to have 2 on the left, right, and a couple on the right, pulmonary veins. Then we have right and left lobar bronchi, or secondary bronchi, right? So after the primary bronchus, it splits into 2 on the left, right? So those are your 2 left lobar bronchi, or secondary bronchi. If you look at the right, it splits into 3 air ducts, right? So you have 3 right lobar or secondary bronchi. What's next? The lobes of the lung. So if you look at this one, you definitely see 3 lobes. That must be the right lung, right? Your superior, middle, and inferior lobe, which are labeled A, B, and C. And you can see the fissures separating them. This process of elimination, it must be the left lung, right? We can see the 2 lobes labeled D and E, and there's your oblique fissure separating those 2 lobes. Then it asks for segmental bronchi or tertiary bronchi. So if we look at these, the bronchial tree, right, it just keeps separating. Right, all of these smaller bronchi that we're looking at here, these are tertiary bronchi, which is going to all different parts of the lungs. You only see little cross sections of them out here, right, but here's your tertiary bronchi. Right, all of those branches near the exterior portion, right? I shouldn't say exterior, right? Along the perimeter of the lung. And the last label is the diaphragm. You can't miss the diaphragm. Big muscle, big dome-shaped sheet-like muscle. The main breathing muscle.